Contents via hiatal hernia. Contents via hiatal hernia. Right crus attaches to L1, L2, L3 of diaphragm. Right crus of diaphragm is longer than left crus. Right crus of diaphragm is longer than left crus. Both the crus are connected to each other by median arcuate ligament running in front of T12 vertebra, making aortic hiatus and allow aorta to pass through it. Also the thoracic duct. Both crusts are interconnected to each other by median arcuate ligament running in front of T12 vertebra, making aortic hiatus and allows aorta to pass through it. Azygous vein punctures right crus of diaphragm to enter into the thorax. In some cases, it passes through the aortic hiatus, so the thoracic duct will be sandwiched between aorta on right side and vein on left side. Hemiazygous vein will puncture left crus of diaphragm to enter thorax. Hemiazygous vein will puncture left crus of diaphragm to enter thorax. Crura are also punctured by greater and lesser splanchnic nerve. Crura are also punctured by greater and lesser splanchnic nerve. Right crus sends muscular fiber around esophagus, passing diaphragm at T10 along with right and left vagus. Few branches of left gastric vessels supplying abdominal esophagus. T10. Branch of right phrenic nerve, caval opening. Left posterolateral opening of diaphragm, Bogdelic foramen, leads to Bogdelic hernia. Left posterolateral opening of diaphragm, Bogdelic foramen, leads to Bogdelic hernia. Morgagni hernia. Right anteromedial, leads to transverse colon into thorax in front of heart and becomes sternum. Rare type of hernia. Morgagni hernia is rare type of hernia. Development of mesentery. Mesentery, double fold of peritoneum, carries neurovascular bundle towards various abdominal vessels. Gut tube is surrounded by visceral peritoneum reflecting to body wall as parietal peritoneum. Between parietal peritoneum periphery and visceral peritoneum around viscera is peritoneal cavity. Development of mesentery. Mesentery is double fold of peritoneum, carries neurovascular bundle towards various abdominal vessels. Gut tube is surrounded by visceral peritoneum reflecting to body wall as parietal peritoneum. Between parietal peritoneum in periphery and visceral peritoneum around viscera is called peritoneal cavity. Dorsal or posterior mesentery. Present behind the gut tube, attaching to posterior abdominal wall. Ventral or anterior mesentery, present in front of gut tube. Dorsal or posterior mesentery, behind the gut tube. Ventral or anterior mesentery, in front of gut tube. Name depends on which viscera it attaches. Example: mesoesophagus, mesoduodenum, mesocolon, mesoappendix. Double fold of peritoneum brings some blood vessel and encloses the viscera and goes to posterior abdominal wall, and by lateral abdominal wall returns to anterior abdominal wall and repeats the same. Liver and its ligaments develop in ventral mesentery. Spleen and its ligaments develop in dorsal mesentery. Liver, ventral mesentery. Spleen, dorsal mesentery. Abdominal aorta and its branches. Foregut, celiac artery. Midgut, superior mesenteric artery. Hindgut, inferior mesenteric artery. Foregut, celiac artery. Midgut, superior mesenteric artery. Hindgut, inferior mesenteric artery. Superior mesenteric artery comes out of anterior abdominal wall to umbilicus to enter umbilical cord. Midgut itself is entering the umbilical cord. It's physiological. Umbilical hernia at 6 weeks. Regresses by 10th week. Its persistence is known as omphalocele. Superior mesenteric artery will be the axis on which midgut rotates anti-clockwise 270 degrees. Superior mesenteric artery will be the axis on which midgut rotates anti-clockwise 270 degrees. Some important information. Spleen develops from mesoderm of dorsal mesentery. Liver develops from endoderm of foregut. Mesoderm of dorsal mesentery. Endoderm of foregut.